Health visitors through the Healthy Child programme will be able to offer services such as smoking cessation, healthy lifestyle advice, sleeping advice, dietary advice and mental health advice as well. I think these 5 or 6 areas are fundamental to the well-being of parents and children and the well-being of families, and I think general practitioners are fully focused on that as well as health visitors, so it dovetails very well with general practitioners' view of how to promote a healthy family.
Because of the holistic approach that health visitors will take, they also look at the bigger picture and the emotional needs of a family as well, particularly in the day and age where we know that mental health and things like postnatal depression are rising. Health visitors are often the first people to actually recognise and to notice that. And they have the knowledge of the community and of the services to then support a family by signposting to other services that were there, and they have the time to actually give them that introduction to those services as well.
We know that nationally there is an increase in childhood obesity, and as a team we are aware of the implications for this on the health of children, and we are looking at our breastfeeding support groups in order to enable mums to continue to breastfeed their children, as we know that this is the best start in life for children and can impact on the future of childhood obesity.
It's that early intervention again. It's also being able to support a family before perhaps they might even need to go and see their GP. So it's the health visitor stepping in at that point rather than someone going to a GP then being signposted to the health visitor. Let's just go straight to the health visitors.
The number of health visitors has been in decline. However, in light of recent studies and reports such as Frank Fields and Graham Allen, the government have responded by increasing the number of health visitors by 4,200 by the year 2015 in order to improve the public health outcomes and reduce health inequalities for children.
The overall aim in increasing the number of health visitors is to improve public health outcomes, to reduce health inequalities and to promote the health and well-being of children and their families.
I think most GPs do have an awareness that health visitors are available to discuss various problems. I think that perhaps in recent years we've not seen as many health visitors as we would like, and so perhaps the health visiting team has become more out of focus for some GPs in certain parts of the country. But this new initiative is hopefully going to address that. It's fundamental to the Healthy Child programme that health visitors understand the dynamics of their own communities and especially the prevalence of specific conditions, for example obesity or teenage pregnancy, so that they can target specific resources to those areas of concern.
The Healthy Child programme is an exciting opportunity to work collaboratively with additional agencies, including GPs, midwives, children's centres, to really make a difference to the outcomes for children in the future by recognising the significance of the early years.
I think that in the years to come, the Healthy Child programme is in a good position to help reduce childhood obesity, help with problem families with behavioural problems, perhaps significant mental health problems, and to protect the lives of children, protect the health concerns of families and children. So for some GPs who may not have worked as closely with health visiting teams in the past as I have, the value of the Healthy Child programme may not be apparently clear. I think GPs and health visitors should work together in an open environment of mutual trust, of course, and I think that health visitors should have ready access to their general practitioners. Likewise, general practitioners should be able to access the services of health visitors when they feel they need to pass on information or need help for families and children. My personal experience as a GP is that I couldn't deliver as coherent a service for children and families if it wasn't for the help of the teamwork that we get through interacting with our health visitors.
We're looking to develop our relationship with our GPs, as we really value working together in partnership with GPs. We've got experience in working with children and their families. We really want to utilise that information and work together with GPs in order to promote the health and wellbeing of children and their families.
GPs can find out more about the health visiting team in their area through the Department of Health, through clinical commissioning groups, and also by contacting their local health visiting team. The health visiting team would be more than happy to go into the GP surgery and update them on the changes in child health and letting them know what the Healthy Child programme consists of and the benefits for both families and also for the GPs themselves.
The e-learning module for the Healthy Child programme is available on the Royal College of Paediatrics and Child Health website, and it's very easy to access.